Hello, greetings everyone, and in today's video we are talking about the cost of malaria in private health facilities in Uganda. And for a small introduction, malaria is the leading cause of O.P.D visits in Uganda, and also it contributes to 25% of all the hospital admissions in Uganda. Therefore, it shows that Uganda is in the endemic areas which suffer high prevalences of malaria cases. And therefore, we need to put in a lot of effort for us to fight the challenge. And in today's video, we are talking about the cost of treatment of malaria in private health facilities, which may include private clinics, private hospitals, and other private facilities rendering malaria treatment. And I'm giving the average price in an average health facility. Not the most expensive ones and not the least expensive. So I'm giving the average mediocre price. And for example, for a child who is 1 year is expected to weigh 10 kilograms. Therefore, that child is liable to get 30 milligrams of artesunate. And in this case, it is expected that the estimated price for treating a 1-year-old child is 100,000 Ugandan shillings, which is also equivalent to approximately 25 US dollars. And therefore, this price is seemingly expensive for disadvantaged people or people who are needed in the community. Two, giving another second example of an average adult who weighs 60 kilograms, that adult is expected to receive artesunate, which is equivalent to 144 milligrams. And the estimated price for a full dose of artesunate in treating a person having malaria is 200,000 US dollars, which is 200,000 Ugandan shillings, which is equivalent to 52 US dollars, making it hard for some people to seek medical services in the nearest health facilities due to the high amount of treatment bill. And therefore, there is a big need for us to support the needy individuals, the needy populations, the needy people in accessing medical support. So, what do we think we can do? Number one, we should invest in preventive measures. For example, sleeping under mosquito nets and other preventive measures which combat the spread of malaria. And two, we should look at the curative measures. For example, treating individuals diagnosed with malaria as soon as possible in order to avoid the severe cases of malaria which literally cause death. And therefore, we as Non-Doctor Medical Foundation, we are aiming at making the world a better place for everyone, especially the low-income people. That's to say, the disadvantaged people in the community. We are therefore coming up with measures which include 1, health education, and 2, we are coming up with a campaign of raising 1,000 mosquito nets, whereby we shall be donating them to poor people in poor communities to help them prevent the malaria disease and also curb the disease burden. We request you subscribe to our channel and follow us for more details and also support our community programs. Thank you and see you in our next video.